Hello, I'm Ashley Whitley, and today I'm going to talk to you a little bit about my student that I'm doing an observation on for the Module 1 Elementary Assessment. His name is Shane. He is in the 5th grade at Blyble Elementary School. He is located in the self-contained classroom. He's 11 years and 8 months. His birthday is on February the 2nd, 2019. Just to give you a little background about Shane, Shane was officially diagnosed with Down syndrome at the age of 3 months. He did have several developmental delays growing up. He did not actually say his first word until the age of 8. His mother ended up giving up full custody of him to the father at the age of 9, and he does receive some visitation with her, but she's not very consistent with that. Shane lives at home with his dad and his younger brother, who is in the 1st grade. Shane really is a healthy little boy. His records show that he hardly ever goes to the doctor. He hardly has any problems with any ear infections or anything like that. We know when Shane is not feeling well, Dad makes sure that he gets him to the doctor right away. Shane had several tests done. He's up for reevaluation this year, but a lot of the testing come back inconclusive, or they were unable to actually perform at all due to the fact that Shane is pretty much, no, I would say 85% nonverbal. He has an intellectual disability. He receives all of his core subjects in a self-contained classroom. He receives 90 minutes of speech every week. He receives 90 minutes of occupational therapy, and he receives 90 minutes of physical therapy. He struggles tremendously with reading and mathematics. He likes to constantly make noises, and although he's nonverbal in the sense of having an actual conversation with you, he likes to repeat everything. So Shane is real big on repeating everything that he says. He loves to play outside, and he's eager to learn. In looking at his diagnostic summary on the Reynolds test, his overall composite score came back as a 42, which is significantly below, and that's why he fell in the intellectual disability category. On his adaptive behavior, his communication is very poor. Self-care, he scored a 0, although I feel that since this testing was a little over 3 years ago, I feel like the self-care has tremendously improved, and this was done based on the adaptive behavior evaluation scale. His home living he received was poor. Community use was a 0, very poor. Self-direction was very poor. Now, his health and safety, he knows when things are hot. He knows when things are cold. He knows not to go outside. He knows what he can have and what he can't have for the most part. His functional academics are very poor, and his work are very poor as well. He is somewhat social, but he does really have a problem with appropriate distance. He is up for a reeval this year, and he has matured greatly. As far as his strengths and needs go, he will try anything that you ask him to try. He does struggle when he doesn't get something the first time. He gets kind of frustrated and often tends to shut down. I'm finding that he does a lot better whenever you work on activities that involve technology. He is able to communicate with you when he needs to use the restroom now and if he is thirsty. And we're beginning to work on academic side with reading, on recognition of letters and sounds, and on math with recognition of numbers. So